How to get an MTP kit safely and legally. This video is for educational purposes only. Watch till the end for complete and useful information. An MTP kit, or medical termination of pregnancy kit, is a combination of two medicines, mifepristone and misoprostol. It is used to end an unwanted pregnancy medically and is generally effective up to 7 to 9 weeks of pregnancy. How to take it, general guidance. Day 1, take mifepristone. Take 1 tablet of mifepristone, 200 milligrams by mouth. With water, this stops the pregnancy hormone, progesterone, and detaches the pregnancy from the uterus. After 24 to 48 hours, take misoprostol. Take 4 tablets of misoprostol, total 800 mcg. There are 2 common methods. Method A, buckle in the cheeks. Place 2 tablets in each cheek between your gums and cheek. Let them dissolve for 30 minutes. Swallow the rest. Method B, vaginal inserted. Right arrow, lie down and insert 4 tablets deep inside the vagina. Your doctor will tell you the best method for your body. What happens after taking misoprostol? You may start to bleed within 1 to 4 hours. Cramping and heavy bleeding are common. It means the medicine is working. Bleeding may continue for 1 to 2 weeks, but should gradually reduce. When to see a doctor immediately? No bleeding after 24 hours of taking misoprostol. Severe pain, high fever, foul-smelling discharge. Bleeding that soaks more than 2 pads per hour for 2+ hours. A follow-up checkup, usually within 7-10 days, is very important to confirm that the abortion is complete. But remember, never use it without consulting a qualified doctor. Thanks for watching.